So yeah, I'm trying to, I've looked everywhere to do the background setting. I don't see it anywhere. Like, I don't know what's going on. There's nothing I can do. So it is what it
There you go.
is. It's like locked, like you can't do anything.
You're good to go, Judy.
Okay, perfect. Thank you. Good afternoon, everyone. Thank you for joining us this afternoon for this panel discussion, Ready Before the Bump, a pregnancy prep presentation by the Maternal Health Committee of Chi Eta Phi Sorority Incorporated. I am Judy Jackson, your moderator for the afternoon. So some of you all may be thinking that what is Chi Eta Phi Sorority Incorporated? Maybe you haven't heard of it. So Chi Eta Phi Sorority Incorporated is a professional nursing organization consisting of registered nurses and nursing students. We have both graduate and undergraduate chapters throughout the nation. Our legacy began in 1932 with Eileen Carrington Ewell and 11 other courageous nurses, and they laid our foundation of this mighty organization. We continue to expand our global impact by embracing cultural humility through continuing education, recruitment, networking, scholarships, and service-driven programs and projects. Our motto is Service for Humanity. I will put our website in the chat. You can always get more information about our organization. And if you know of any students that are nursing students or nurses, you can share that information with them as well. Our national president is Samantha Agee, and she had a prior commitment this afternoon and wasn't able to join us. However, our first vice president, Dr. Deborah Stamps, is present this afternoon. Deborah Stamps, can you bring greetings on behalf of Samantha Agee?
Thank you so much. Thank you. Thank you. It is a pleasure to be with all of you this afternoon. To our esteemed members of the Maternal Committee, thank you so much. You are doing amazing work and making a huge difference in the many communities in which we serve across the country. On behalf of the Board of Directors, it is my distinct pleasure to welcome you to today's webinar, Ready Before the Bump. We commend your unwavering dedication to advancing maternal health and ensuring that every journey into motherhood is supported with knowledge, care, and compassion. This is an important initiative and really reflects the shared commitment to empowering families through education, preparation, and community engagement. By fostering early awareness and readiness, we are taking meaningful steps towards healthier outcomes for mothers and infants. We extend our sincere appreciation to the organizers, the speakers, and the participants who have come together to make this event possible. Your contributions continue to inspire progress and positive change. Wishing all of you a productive and enriching session. Thank you so much.
Thank you, Dr. Stamps, for that. So I really want to take the opportunity to introduce you to the three panelists who are first and foremost my sorority sisters. And we work together, as I mentioned, on the Maternal Health Committee for Chi Eta Phi Sorority Incorporated. I am so very proud to introduce them to you all today. Again, I am Judy Jackson. I am your moderator. I am a registered nurse as well, educator, and a speaker with more than 40 years of experience in nursing. I have spent my career caring for women, families, while still teaching and mentoring others in the healthcare field. I hold advanced degrees in nursing, nursing education, as well as healthcare administration, and I am certified in both nursing education and obstetrics. But beyond the titles, my true passion is really helping women better understand their bodies, prioritizing their health, and practice self-care. In addition to my nursing career, I am also a small business owner of Judy's Jewels, where I really combine my love for fashion and for confidence building. But above all else, I am a proud mother of two and a grandmother of a beautiful baby girl. I'm a member of the local chapter of Chi Eta Phi Sorority Incorporated in Houston, Texas. Next, I want to introduce the next panelist, and that is none other than Dr. Janet Williams. We fondly refer to her as Dr. J. She is the chairperson of the National Maternal Health Committee of Chi Eta Phi Sorority. She is a doctoral prepared nurse midwife, consultant, educator, and author who imparts information to women and healthcare providers alike. She worked in collaborative hospital practice for 23 years, where she has attended more than 900 births. She also is a member of the National Black Nurses Association, the Black Maternal Health Equity Committee. She is the author of 2 books, Transitions, the Fourth Trimester Journal, and Transitions, a Midwife's Pregnancy Reflection Journal. She is a member of the local chapter of Chi Eta Phi Sorority, Kappa Eta chapter in Long Island, New York. Next today, we're going to have Dr. Latanya Law Hodges. She has spent her career in nursing that has exposed her to virtually all aspects of care, from educating and advocating and providing direct patient care for over 20 years. Her focus for the last 13 years has been working as a doctoral prepared nurse practitioner. In her extra time, she enjoys precepting students and giving back to her community. She is also passionate about education and staying current and making a difference in the future of nursing and in her career. While her profession is a big part of her, she remains a busy mom, wife. She enjoys traveling, spending time with family, and playing golf. She is a member of her local chapter of Chi Eta Phi Sorority Incorporated, Gamma Chi chapter in Atlanta, Georgia. And next we have Jamila Batts. She is a registered nurse and public health leader with over 20 years of experience, dedicated to improving the health of women and families. She serves as a program manager for the Office of Minority Health at the Tennessee Department of Health, where she works to reduce disparities and strengthen preventative care across communities statewide. Her work has long centered on maternal and preconception health. As a former fetal and infant mortality review team leader for the Shelby County Health Department, She worked alongside community partners to address systemic contributors to poor birth outcomes and directed Marcha Dimes funded preventative programs. Jamila is currently pursuing her PhD in nursing at the University of Memphis. She is a member of her local chapter of Chi Eta Phi sorority, Chi 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 in Memphis, Tennessee. Please drop some emojis and give the panelists a warm welcome. So, a few housekeeping things before we jump into everything. If you have questions, please place those questions. If you have comments, put them in the chat or the Q&A section. You should see that at the bottom of your screen, whether you're on a computer or a tablet or a phone, and then we will address it as we go along, but for sure, we're going to make time at the end for questions and answers. As we begin this discussion here, it's really important that we take a moment to really ground ourselves in the current state of maternal health. I'm sure you guys have seen both in the news, headlines, social media, really what is happening in the realm of maternal health. And so in order to do that, I am going to help, I'm going to have, Dr. J help us understand really where we are and why the work of preconception health is so important. So if you first just take a moment as she comes to the stage and put in the chat, when do you think we as women should begin preparing for pregnancy? There's no right or wrong answer, but when do you think we should start preparing for pregnancy? So Dr. J, can you fill us in on the stats and get us grounded?
Yes, ma'am. Thank you so much for the introduction. Before we even talk about pregnancy, I want to first ground us in the reality of the current maternal health in this country. Right now in the U.S., the maternal mortality remains far too high. The most recent data shows a maternal mortality rate of 17.9 deaths per 100,000 live births. And for Black women, that's a rate of 40. That is the rate of 44.8 deaths per 100,000. Once you extrapolate that out, that means that Black women are still 3 to 4 times more likely to die from maternal causes than white women. And when we look at pregnancy-related deaths more broadly, more than 80% of them are preventable. We also need to be clear, this is not only a labor and delivery issue. Pregnancy-related death is measured during pregnancy and up to 1 year after the end of a pregnancy. So the CDC, which is the Center for Disease Control, data shows that 23% occur on the day of delivery or within 7 days, the death. 22% occur between 7 and 42 days, and about a third of them occur between 43 days and 1 year after. In other words, the timeline does matter, and our support can't stop at the time when a woman has a baby and is discharged. Well, first, I want to define a few things. Conception, first of all, is the union of a sperm and an egg, a moment that pregnancy begins. So preconception is your preconception health is your physical, mental, emotional, and social health before a pregnancy begins. And that matters because in the United States, about 48% of pregnancies are unplanned. Notice I said unplanned, not unwanted. It's just that the timing was unexpected. So from a nursing or midwifery perspective, preconception care is preventative care. This is where we can reduce the risk before physiologic stress increases. By the time someone realizes they're pregnant, important development is already underway. And here's what we know. Many of these conditions that contribute to maternal outcomes are already present before pregnancy begins. Hypertension affects 1 in 10 women and is directly linked to the hypertensive disorders we see in pregnancy and to cardiovascular disease, which is the leading cause of maternal death. Diabetes affects about 4 to 6% of women. And when not well controlled, it increases the risk of complications during pregnancy, like preterm delivery and birth, or poor outcomes. Thyroid disease affects about 2 to 5%, which is often undiagnosed, and that can impact both maternal stability and also fetal development. These are not rare conditions, these are everyday realities for many women. And we have to understand that pregnancy is nature's stress test. So if these conditions are already there, pregnancy does not hide them, they amplify them. So when we talk about preparation, we're talking about simple things, but important things. Know your blood pressure, know your blood sugar, review your medications, pay attention to your mental and emotional health, because if you want different outcomes, we have to start earlier. Thank you.
Thank you, Dr. J. So I see where you guys have put in the chat, I asked the question about when should it start? And you guys are right on target. You're putting that once you can get pregnant, right, is a good time to go ahead and start thinking about that. But Dr. J really shared, 48% of pregnancies are unplanned. And she emphasized not unwanted, but unplanned. So it's important that we do have this discussion ahead of time, right? So that we can give ourselves and our babies the best start moving forward. So thank you so much for that information, Dr. J. So, as we begin to talk about preparation, right, there are many things that we can start doing even today, that we can share with our families, our friends, our best girlfriends, right, on what we can do. What are some lifestyle preparations that we can do? So, Jamila, I have a question. So, what are some of those things that women can start doing right now to prepare for a healthy pregnancy, even before they even think about going to a provider?
So when we think about preconceptional health, one of the questions we often say is that it is overlooked. And what we're really seeing is a transition. Historically, our healthcare system has focused on pregnancy and childbirth and not the preconception period. It's only more recently, with efforts from organizations like the Center for Disease Control and March of Dimes, that we really started to recognize how important health before pregnancy is. And even now, a lot of people engage in healthcare reactively. So they come in with something feels off, or once pregnancy is confirmed. But in the public health space, one of the things that we're doing is going out in the community and creating those early conversations. And so we're asking, are you thinking about pregnancy in the next year? And depending on their response, we start to have a dialogue. And so if their answer is no, I'm not thinking about pregnancy in the next year, then we have that conversation about what they're doing to make sure they don't become pregnant in the next year. And if their answer is yes, I'm thinking about pregnancy in the next year, then we start to have that preconception health conversation. So that can look like talking about physical activity. That can look like talking about their nutrition and also their mental health. So, we're asking, are you getting enough rest? If you're feeling stressed, do you have outlets and ways to kind of deal with that stress? And because people engage with healthcare reactively, when we think about what's going on and what might be getting in the way, some of the barriers we can look at are things like inconsistent access to healthcare, whether that's limited healthcare coverage, gaps in insurance between pregnancies, or not having a regular provider. And also the fact that preconception health just isn't something we talk about regularly in everyday life. So it's not something people are always thinking about or prioritizing. So this is where the community can really start to shift things. by normalizing those preconception conversations earlier. Checking in with one another, encouraging preventive visits, and thinking about health as something we take care of before pregnancy and not just during it.
Thank you. So, sometimes I share with family members and friends, I tell them that, like for instance, we just had Easter, right? And that's a big holiday that we celebrate and we often gather together. So I think about Easter, I think about in the summer, right? Family reunions and even Thanksgiving. That's another big one. When we're in those big groups like that, that is a great time to find out your family history, right? So, Jamila, can you talk a little bit about like why that conversation matters? What kind of information should we be asking when we do speak to parents and grandparents and siblings? What are some of those things that we need to be asking about?
So that's an extremely important question. Family history really gives us a starting point for understanding a woman's risk factors, especially as it relates to pregnancy. And when someone says high blood pressure runs in my family or diabetes runs in my family, that helps us to kind of begin to identify patterns and think a little bit more proactively. And so when I say it's a starting point, I mean it helps us to ask better questions earlier. It allows us to say, okay, this might be something we need to monitor more closely, or let's talk about what prevention could look like for you. It can guide things like screening, lifestyle conversations, and even how frequently a woman will come in for prenatal visits. For example, if someone shares that high blood pressure runs in their family, that may prompt earlier conversations about monitoring and help us stay ahead of conditions like preeclampsia. It also helps us look at the bigger picture, not just what's going on right now, but what can we get ahead of. Um, but what I always like to emphasize is that family history isn't destiny, it's information. It gives us the opportunity to be proactive instead of reactive. So when we think about what might get in the way of an individual sharing their family history when they start prenatal care, it can kind of look like them not knowing their family history, or those conversations just not happening. And even when people do know, they may not realize how important it is to share that information with their provider. So, with that in mind, this is where the community can take something simple and turn it into action by starting those family medical history conversations. You might ask, do we have a history of this? Or did anyone have complications during pregnancy? And then bring that information into your healthcare visits so we can use it to guide prevention and not just respond to conditions when they show up.
Thank you. I love that. Your family history isn't your destiny, but it's information. That is powerful. Thank you for that. So, another question I have, Dr. J. So, tell us what are some things that we can start doing before we even think about scheduling a visit with a provider?
Okay, we can do one of the most powerful examples of prevention is something so simple, effective, and accessible. It's folic acid. We can start taking a multivitamin with 400 micrograms of folic acid in it. If you start taking it daily, it can help prevent something down the line that I'll explain to you. A neural tube defect. Okay, we said that 48% of pregnancies are not planned. Okay, by the time you know that you're pregnant, the baby is already being formed. The brain and the spinal cord are already being formed, usually by the time you find out you're pregnant. A neural tube becomes the baby's spinal cord and brain, and it forms about 3 to 4 weeks after conception. That's why the CDC, again, the Center of Disease Control, recommends that anyone who can become pregnant take 400 micrograms of folic acid every day. And so once a young lady has her menses, at that point, I would tell everybody, every mother, every young woman, you should just be on a multivitamin. It's good for you anyway. Before folic acid fortification in the US in 1998, we saw a significantly high rate of what we call neural tube defects, like spina bifida. And that was a defect in the spinal cord. Sometimes the rate used to be 10 to 11 per every 10,000 births. But since they started putting folate in bread and cereals, those rates have dropped to about 5 to 6 per 10,000 now. So that's prevention in action. And for those who may not be familiar, spina bifida is a condition where the spinal cord never fully closes. And those children can be affected by requiring surgeries. They can have difficulty walking or be unable to walk, and they experience lifelong challenges with bowel and bladder function. So even during my training, I can remember many children living with this diagnosis. But since we started knowing about folic acid, that you don't see it as often. So this is not complicated. It's about a small, consistent step that makes a real difference. And this is what we mean when we say prevention starts before the bump, before labor, before crisis.
Dr. J, can you repeat? Somebody asked again, what is it called again that they should be taking? And I know you mentioned a multivitamin with folic acid, but what should they look for in the labels, maybe? Because I think not all multivitamins may have it.
Okay. If you look for any vitamin that says women's vitamin, look on the label and you should have folic acid. And it should be 400 micrograms. And most women's vitamins have that. They also sell folic acid just as a separate pill, but you can get it in just a regular multivitamin, one a day or any of those brands, women's vitamins.
And I'm gonna ask you another question, Dr. J, since we are talking about the vitamins. Someone asked, what about over-the-counter prenatal vitamins?
Over-the-counter prenatal vitamins should have the 400 micrograms of folic acid in it. Yes.
Thank you. I'm also going to take another pause to answer some questions before we move away. Jamila, there's a couple of comments in the chat asking, how do we include dads, fathers, or male caregivers in these conversation and plans? And isn't their family history kind of just as important? And is there some type of checklist or questions that we should be asking when we are trying to create a family history plan?
I would say that the father's information is just as important as the mother's information. Preconception health is not just about the mom, it's about the dad because his emotional health, his physical health, his mental health, all of that will impact the mom while she's pregnant as well as that developing baby. So everything that the mom does, asking about her family history, especially your mental health family history, because you never know how your mental health will be impacted once you bring a pregnancy and a child into the equation. So just knowing about the dad's physical conditions, high blood pressure that his family may have had. Also understanding if any mental illnesses run in his family. So just the full gamut of your physical health and mental health is important for the dad as well as the mom. And so preconception, I always say preconception health is not just the mom, it's the dad. We usually think about the mom because she's carrying the baby, but that dad is supporting the mom and the baby. So his health is just as important.
Thank you. Thank you. I hope that answered the question. So, Dr. J, I know you talked about the importance of folic acid with the vitamins. Is there anything else that we need to that we can start doing today in preparation?
Yes, we know that smoking is not good for anyone, but I would tell everyone, if you smoke, try to stop, try to cut back. If you need help, go to your provider. There are so many aids to help you stop smoking, nicotine patches and medication that can help you with that. Also, alcohol in moderation. We don't know how much alcohol is detrimental to a fetus. There's no known exact amount. So if you are drinking alcohol and you could get pregnant, possibly, you should be always drinking in moderation. No binging, and an occasional drink, but no binging. The worst thing I think that I've seen as a midwife is people coming in finding out they were pregnant and then worrying the whole pregnancy because they had a night where they really drank too much and now they're worried about their baby. So cutting back on alcohol, stopping smoking, trying to eat properly, those kind of things you can start today.
Thank you for that. So we've spent some time, right, talking about all of these things and lifestyle, family history, the fathers and the male caregivers, and about preparing for your health. So the next logical step, right, is kind of what happens at that provider visit when you are trying to prepare for this. So let's just kind of switch our focus, and I'm going to ask you, Dr. Law Hodges, that really once someone comes in for a preconception visit, or even if they're just having their yearly routine GYN exam, what are some of the things that you would say they can expect from their provider to review to help prepare for a healthy pregnancy?
Okay. So in regards to preconception visits, this is ideally done 3 months before trying, which helps identify and address health concerns by reviewing medical history, adjusting medication, managing chronic conditions such as diabetes, thyroid problems, and screening for infections or genetic risks, and updating vaccinations. The whole goal behind preconception visits is to optimize lifestyle, diet, and the weight to ensure that we have a healthier pregnancy. We definitely want to do like a medication and health assessment to make sure that we're managing chronic conditions such as high blood pressure, diabetes, and thyroid issues, and also epilepsy as well, and to minimize everything before the conception. So the main thing behind preconception visits is to um, kind of educate the patient in regards to lifestyle and reproductive health. This will include and discuss the nutrition, the exercise, alcohol, smoking, drug use, any harmful habits that could be a problem with preconception. Also, weight evaluation is normally done, and also a pelvic exam can be done as well. So that is really one of the major things that we want to do with the preconception, because we want to identify any pre-existing conditions or habits that could be a problem for the patient. Another big thing is want to make sure that the vaccinations is up to date, because one thing that we want to make sure is that they have up-to-date vaccinations of the chickenpox and the rubella. This help prevents any complications during the pregnancy. And we recommend that they start with prenatal vitamins and, as discussed before, folic acid to help prevent any birth defects. So the proactive approach helps to manage any fertility declines or anything like that regarding like with age or anything. So all of this is done in the preconception time to address any potential health challenges early.
So someone put in the chat asking, so do providers routinely offer genetic testing for both mom and dad, or is this something that you have to request?
So when it comes to genetic testing, those questions are asked during your assessment. So if it's a red flag that come up, then of course we're going to go in deeper with it in regards to the genetic testing. So it depends on the red flag and the factors that's involved. Because if we have someone that has a history of something, then we'll dig a little deeper. And those, when you're asking these questions and you're assessing the patients, is to find out information from both sides of the family. where the patient doesn't make the child by itself. So if the mom says, well, I don't have any problem, but the dad could potentially have X, Y, and Z, or, the mom could have it. So any red flags give us the idea of what different tests that we have to give. Now, when it comes to like, if you're at age, you'd like advanced age, genetic testing could definitely be done, without having to ask for it. When you're younger, you might not see it as much. But you can always advocate for yourself and ask for these tests yourself. You don't have to wait for someone to bring it up to you. But it's not like a routine genetic testing, because those tests normally might not be covered on the insurance unless it's needed. But if it's something that you want to pay out of pocket, that's fine as well. But it's not like a routine thing unless there's red flags to give us the push that we have to do it.
I love that about being proactive, going to your appointments, prepared with those questions that you want to ask, because a
Right.
lot of times, we get in there, they don't have a lot of time for an appointment, the providers do, and they have their questions they're asking, and then we may forget something, and it's on the ride home, they're like, oh man, I forgot to ask. So always be prepared and write down your questions. That really helps a lot for sure.
Right, right, right.
So, what else, Dr. Law Hodges? How does that visit really help identify or even address any health concerns before the pregnancy begins?
It gives them a better idea, and it gives them control of what they need to do to make this happen, because the ultimate goal is to have a healthy pregnancy. So this whole visit is not just really for the pregnancy, it's a lifestyle change. So even when they have the child, they'll still be able to have this lifestyle that, to continue even after they have the child. So we really want to ensure that any information reaches people. So sorry.
So she just had to step away for a moment. So we are going to continue because that is life, right?
Yes.
That is definitely life. So
So
it is.
sorry about that.
Yes,
But
okay.
anyway, so when we're dealing with educating our patients, we want to make sure that they understand. We want to do this by giving them tailor the message to their needs. If anything is unclear, we want to be concise. We want to use the language that is needed, their preferred communication. So we want to be able to teach them about a lifestyle, not only when they're pregnant, but to also carry through after they deliver. So that is the ultimate goal behind teaching and giving them the education during the conception, time that we're talking with them.
Absolutely. Thank you. Thank you. So please go ahead. I've been trying to answer or address the questions as they have been coming through the chat. So please feel free to ask any of the questions that you may have. This is your opportunity, right? To go ahead and get those questions answered. And I'm going to ask a few other questions because I think that lifestyle part and getting ready is so very, very important. So, Jamila, earlier you had mentioned about, the physical part of your health is important, but how do we really talk about the mental and the emotional, and why is that so important?
So, the mental health is extremely important, and it's extremely important, and it's an extremely important aspect of the preconceptional health care that we don't really always connect together, and it's often overlooked. Things like stress, anxiety, and depression don't always stay separate from our physical health. They show up in everything. So they can affect your sleep, your blood pressure, your energy, and even how you show up for your own care. And honestly, a lot of women that we serve are carrying a lot between work, family, relationships, finances, and sometimes there just isn't enough space to slow down and process it all. And then on top of that, there's still stigma around mental health. Some people don't feel comfortable talking about it, or they don't know where to go for support. And access to mental health services like counseling, therapy, or even just someone to talk to can be limited. And whether that's because of cost, insurance, availability of providers, or long wait times. So for the community, this is where we really must show up for each other. It can be as simple as checking in and asking, "Are you okay? Are you okay for real?" Like not just the normal "Are you okay?" and it's just kind of a normal reaction. Say, "Yes, I'm okay." Like, "Are you really okay?" And creating space where people feel safe being honest about what they're going through. And I will add a little shameless plug here. Programs like Mental Health First Aid are a great way to build those mental health support skills. I'm actually a certified mental health first aid instructor, and I always like to say mental health first aid.
Can you hear us, Jamila?
Oh, hold up. Something's going on with the computer. Give me 1 second. Don't know what
No
happened.
worries.
Okay.
That's technology for
I
you.
know, I know.
Right. It's
Okay.
okay.
Okay. I am back. Okay. All right. So I will add a shameless plug here. Programs like Mental Health First Aid are a great way to build those mental health support skills. I'm actually a certified mental health first aid instructor, and I always like to say mental health first aid is kind of like CPR, but for the brain instead of the heart. You don't have to be a professional to become a certified mental health first aider. And it teaches you how to notice things when something just might be off, as well as how to check in and how to support someone or help connect them to the right resources. And it really gives you the confidence to say, "I see you and I got you." And because when we support mental health early, we can show up for each other sooner. And that's something all of us can be a part of.
Thank you. Um, Another question that's come through the chat, Dr. J, is what is the difference between folic acid and folate?
Folic acid is a man-made vitamin B that was from the folate is the natural, and folic acid is the man-made version of that vitamin B. That's why they're able to put it in and fortify that the cereals and the breads and different things like that.
Thank you. Another one, Dr. J, is what things can a mom do if she learns her family history, that they had preeclampsia, her mother and maybe some other family members, or even gestational diabetes? What can they do? Or if they had, the baby blues or depression, what are some things that they can do?
First thing is that they are now knowledgeable about that, so they'll bring that to their provider. During the preconception visit, they'll talk about it, but they'll also talk about it once they become pregnant at their first prenatal visit. Those are things that would make us look closer and monitor it a little more closely in a pregnancy. If you have a mom or a sister that had preeclampsia, we're going to watch you a little closer. You would go home with a blood pressure cuff if you were my patient. We would talk about all of your risk factors. And if you had other risk factors, You might be on a baby aspirin. That's the new treatment to preventative care is baby aspirin. And that's something you have to talk to your provider about. That's not something that people should go ahead and do, but that's a conversation between you and your provider. That might be something that they would offer if they knew you had that risk factor and other risk factors along with it. Um, it's just very important that we know that gestational diabetes, for instance, many women that have gestational diabetes in a pregnancy, when we test them afterwards, it's gone. We want to also find out if your mom or sister had gestational diabetes. Did it go away, or are they now years later diabetic? So that would also, help us to monitor you. So those are very important things, and that family history is just one of the biggest things that you can do when you're coming in, is to have the information.
Thank you.
Mhm.
So somebody put a term in the chat, and I'm not sure what the question is, and I'm not even familiar with the term. It's epigenetics. Are any of the panel familiar with that and what they could be referring to?
I really can't speak to that. I don't have enough information to be quite honest with you.
Yeah, so if you could, if for the person that put that in the chat, if you can specify a little bit more so that we make sure that we are answering your question. So we are close to running out of time. I just want to do one more question for any of the panelists. She says that with my almost 2-year-old, I was diagnosed with severe preeclampsia and HELP syndrome, and she delivered at 32 weeks. The end of this year or early next year, her husband and I are looking to try to start conceiving again. Anything specific I can work on now until then to decrease my chances of having preeclampsia again? My blood pressure has been normal, yay, since giving birth. Before getting pregnant, and up until 32 weeks, I didn't have any issues with my blood pressure.
So preeclampsia and HELP syndrome, those are just two very severe forms of hypertension in pregnancy. And the main thing I would do is to make sure that you continue to see your primary provider up until the time that you're going to um, be conceiving, and make sure that, like you said, your blood pressure is fine. Just continue to go and make sure that everything is stable. I would say pay attention to weight. If your BMI is a little over, you may want to speak to your provider about possibly losing a little weight. You want all your risk factors as low as possible. When you speak to your provider and you finally conceive, they're going to look at your history. They're going to give you things to do. You will probably be on a baby aspirin because you have a history of this, and you'll be watched closely. And so, just the healthy lifestyle, the rest, decreasing stress, all the things we spoke about.
Thank you.
Mhm.
And so thank you so much for the person who put the topic in there about epigenetics. And so they have there, it's trauma passed from your ancestors and it affects your genetics. And they have put in some information in there. One final question, Dr. J, is it better to take folic acid or folate?
I would say take what both are fine, but I would use the folic acid because one, you're going to be on prenatal vitamins once you're pregnant, so that has folic acid. So you can just start taking just a regular, like I said, multivitamin with folic acid, or a prenatal vitamin with folic acid, 400 micrograms a day.
Thank you.
Mhm.
So as we wrap things up, I really want to call on each of our panelists and ask really a final question of you. And really, it's like if it's some word of advice or a call to action, what is just one thing that you think that the participants today can take after this discussion and act on as a result for preconception health? I'll start with you, Dr. J.
I think the biggest thing I want people to walk away with is the fact that 48% of pregnancies are unplanned. And so we can say we want to get pregnant in 2 weeks and then we get pregnant in 1 week. So we need to be on top of this at all times. I think we've heard enough today to know that we need to not, cut back on smoking, make sure our weight's under control, make sure that we're taking a vitamin every day. And once we hear all this information, I would like to say that everyone that heard what we talked about today is now a health ambassador, and take the information that we gave you and share it with your sisters and your friends and your colleagues and the community that you live in.
Absolutely. Thank you. And what about you, Jamila?
I would echo what Dr. J said. Just it's important to just be healthy before you go into your pregnancy. If you are told that your blood pressure is elevated, or if you're told that your blood glucose is out of the normal range, make sure you make a priority to follow up and get that managed before you think about starting a pregnancy and bringing a baby into the world so that you can have the healthiest outcome for you and your baby. So I would just say any red flags that come along, even if you're not pregnant, make sure you follow up and do those next steps.
Thank you.
Um,
Yes, Dr. J.
I'll speak for Dr. Latanya. She had to step away for a moment. My last other thought is this. When birthing people come in, oh, you're back. Okay, I'll let you finish. I'm just going to say that when birthing people come in for their first prenatal visit, I want people to come in comfortable and not worried about what they did right before they found out they were pregnant, that now they're worried about. So think that way, if I were to get pregnant tomorrow, is there anything that I'm doing today that would make me worry the whole pregnancy?
Thank you. Dr. La Hodges, give us one thing you want people to take away from today that you think they can do to make an impact.
So, they want to take the knowledge to action and put it into action. When balancing life challenges, it requires starting with small, manageable steps to build a momentum rather than seeking perfection. You want to implement change by breaking goals into tiny daily actions, reflecting on progress to adjust strategies, and also utilize support networks to manage stress and stay accountable. I think the biggest thing in regards to preconception and wanting to bring in, to have a family and to build a family so you can have a 3-year-old like me running around here right now is to decrease stress. Your main goal is to decrease stress. You want to be able to bring and breathe life into your uterus. So your main thing is you want to take on little daily actions and to be able to adjust different strategies to help you along the way. So start small. Focus on just little micro actions to help you meet your goals. Meditation, take on different tasks. Try to avoid being overwhelmed. And just try to overcome different things that might have you stressed out. So what I want you to take from the information that you received today, it might be a lot, but it's definitely doable. You just take it in small dosage to be able to take care of yourself and to become healthy enough for the stage of when you're ready to have a child.
Thank you.
Mhm.
So I just want to take this opportunity to first thank all of the panelists for this wonderful discussion, and Birthing the Magic for allowing us to participate on this forum and share this information. And I know that there's information about how to contact these panelists. If you have additional questions, their contact information is in the chat. And I've also, if you're curious about Chi Eta Phi Sorority Incorporated, or like I said at the beginning, you know of a a nurse, male or female, or a nursing student, please connect them with our website. We would love to connect with them. Any other final words from the panelists?
Mhm.
Thank
Have
you
a great
all for participating today, and your questions have been wonderful. I hope that you all have learned something and you're taking away something either for yourself, your best girlfriend, or a family member. Thank you so very much.